Many of us have become more conscious of our overall health and immunity during the last year and a half, and iron plays an important role in this. Dr. Dixon is here to give us the lowdown on iron deficiency and how it can affect our immune system. So thanks so much for joining us, Marge. This is an important topic. For those viewers who may not be familiar with iron deficiency or iron deficiency anemia, what exactly does that mean, and how does that affect our bodies?
Okay, so iron deficiency anemia literally has to do with iron in our bodies, and when you're iron deficient, it means that you don't have enough iron in your body or you lack iron stores. The reason why this is important is because our blood has an important molecule called hemoglobin, and it's made up of iron, and this is what carries oxygen through our bodies. So if you don't have enough oxygen, you're not doing well in your tissues, you get side effects. And actually, iron deficiency is the #1 reason for anemia worldwide, and it's the #1 nutritional deficiency worldwide. And it starts kind of insidiously and slowly, so you don't wake up and know you're anemic. You have dizziness, you feel short of breath, you have difficulty concentrating. And this can affect your daily living. You might have restless leg syndrome. You might have blood pressure dropping when you go from sitting to standing. Like, these are all signs, but they don't start like jazz hand signs. They say, oh, I'm feeling a little tired today. And then what does it do in our overall health and immunity? Well, you can imagine if you feel listless and dizzy and tired and you can't concentrate, how do you work? How do you go to school? So it really impacts your daily living. And it does play a role in our immunity. Our immune system, in order to be healthy and robust, requires iron as a cofactor. So iron is required for certain cells called lymphocytes in the immune system for activation and differentiation, so they can go fight that battle through your body when you have an infection. Other cells of the immune system called macrophages also require activation and proliferation so that they can work healthfully as part of the immune system with the iron, and iron is part of that action. Now, I would caveat that I don't want everybody going out and taking iron right away. You have to also be careful, because if you take too much iron, that can actually feed pathogens, and they can build an ability to attack you better because they also use iron. So iron is essential not just to people, but also to the bacterial pathogens. So when you're feeling listless and not well and tired, and you think you might have iron deficiency anemia, you need to talk to your healthcare provider about it.
Now, you know this already. I suffered from an iron deficiency myself not that long ago, and I felt all those symptoms. I felt listless, I was dizzy. So I made sure that my first point of contact was with a healthcare provider.
You talk to your healthcare provider because they have to rule out anything insidious. Remember, you know, there's a differential diagnosis. We're the experts. We have to make sure it's nothing really bad. But then also, we have the issue of, okay, if we're going to go to surgery, potentially, we may lose more blood. And then how do we make people's iron stores replete so that we are ready to do the surgery and potentially further loss? And so we have to sometimes supplement our patients and figure out what the best way of getting iron back into their diet. So, I mean, you were iron deficient. I was iron deficient as a teenager when I had really heavy menstrual periods. So doctors prescribe iron supplements. And there are tradition iron supplements that I don't know about you, but I was really bad at taking, because you had to take it 3 times a day. And it gets absorbed in the gut, and so it causes a lot of gut grief. And the iron is actually made to be absorbed in the small intestine, in the duodenum, actually. And so any extra iron that didn't get absorbed in the gut actually sits in your colon and causes constipation. Nobody likes constipation. And then you have to remember to take it 3 times a day. So segue to 2021, when we have other options. And those options allow us to take it less frequently. And one of those is Ferromax. So Ferromax Therapeutic 150 has a polydextrose iron complex, which is a lot of science words to say, that allows for a different absorption. So you don't get the problem with the gut. It gets absorbed in the proximal ileum, which is the duodenum, the early part of the small intestine. You only have to take it once a day. It doesn't give you gut grief because it's absorbed in the site that iron is supposed to be absorbed in. And taking it once a day is because the reason why it says 150 is there are 150 milligrams of elemental iron. That's what you need to put back into your stores. Remember I said the other ones we had to take 3 times daily? Well, that's because the amount of elemental iron per pill, and these were like hard pills, by the way, was less. And so, you know, teenagers or women are busy. We don't like to take things 3 times a day. And the advantage of this, I'm going to show you, it's a little pill. You can actually put it into water, juice. Mix it in, Tracy. You see?
Awesome.
right? And patients tell us all the time, doctor, I'm sorry, I couldn't take it, I didn't like it, the side effects, whatever. Doctors like this. I like this because it's patient-centered.
Super versatile. Now, what are some other ways to increase our iron, Marge?
Well, I talked about intake. Either you have not enough intake or not the proper intake, or you're not getting absorbed properly. So we have a lovely display here, Tracy, of options foods that are rich in iron. Now everybody knows I'm Jamaican. My grandmother used to make liver and onions, Tracy, because I was iron deficient. You can get it from steak. Actually, the best source of iron from food comes from meat. If you're a vegetarian or a vegan, that creates a problem for you. So you have to know the other foods that are rich in iron, the dark green leafies, legumes, beans. And the reason why we have citrus fruits here is because you can absorb iron better when you have vitamin C. So citrus fruits, things that are rich in vitamin C, avoiding drinking things like teas and coffees too frequent or too close to when you're going to take your iron because it interferes with iron absorption. All of this is available online, and also if you're wondering about symptoms, Ferromax also has online something called a symptoms tracker. Use that as the jumping off point when you go to see your doctor, and it's available online. You bring it with you to your doctor and you're like, okay, do I have the symptoms? These are the symptoms that I'm having. I'd like to talk about them. I think I may be iron deficient.
Dr. Dixon, as always, you are a wealth of information and knowledge. Thank you so much for that insight. Now, if you at home want to check out Ferromax's online symptoms checker, be sure to head to cityline.tv so that you can use this tool to start a conversation with your healthcare provider. We want to help you out.